Question: a nurse is making a room assignment for a month-old child with bacterial meningitis. The nurse plans to place the infant in which of the following rooms? Option A: isolation room with negative air pressure. Option B: isolation room near the nurse's station. Option C: a room with a 12-month-old child with a ventriculoperitoneal shunt. Option D: a room with a 12-month-old child diagnosed with diarrhea. The correct answer is option B. Question: Wesley, a nurse supervisor, manages the nursing staff, prepares the budget, maintains client service, and implements policies. These tasks are accomplished by performing managerial functions. When Wesley uses performance standards as criteria for measuring success, he operates through which of the following functions? Option A: directing. Option B: controlling. Option C: organizing. Option D: decision-making. The correct answer is option B. Question: a nurse is making a room assignment for a year-old boy with a brain concussion. The nurse determines to place the boy in a room with which of the following clients? Option A: a 3-year-old boy who had a club foot repair. Option B: a 12-year boy with rheumatic fever. Option C: a 12-year-old boy with measles. Option D: a 10-year-old boy with a fractured leg. The correct answer is option D. Question: a nurse is assigned to care for 4 clients during a shift. After reviewing the client records, the nurse knows that it is most important for which of the following clients to receive the scheduled medication on time? Option A: a client diagnosed with tuberculosis, treated with streptomycin. Option B: a client diagnosed with depression, treated with amitriptyline. Option C: a client diagnosed with myasthenia gravis, treated with pyridoxstigmine bromide. Option D: a client diagnosed with urinary tract infection, treated with ciprofloxacin. The correct answer is option C.